Hi, everybody. This is Alethea. I'm just showing you progress. Y'all remember I had my total left knee placement done Tuesday, and I'm doing pretty good, y'all. Y'all remember my right knee that was done 7 years ago? You see how the stitches and everything looks. And this is my left knee, y'all. It's wrapped up in the ice machine. You see my legs is a little swollen, but I'm doing pretty good. I have my friend Leah. She comes here every day to check up on me. She helps me go for my walks. I had the therapist. He comes Monday, Wednesday, and Friday. Meanwhile, she comes in here and sits with me and walks with me, make sure I don't fall out the bed, which I did, y'all. Yes, y'all gonna laugh, y'all. When I was trying to get up to go to the bathroom and slide my foot, y'all, boom, I went on the floor. But thank God I didn't open up my scission or bruise it. And this is the walker they give you, y'all. I'm gonna show y'all a little bit. See y'all when y'all take it off. But look, y'all, I could do this with my knee, bend it. Sorry, y'all, my left knee, I could lift it up high and bring it down low. They tell us to always practice with the pump, pumping up your leg. I've taken the medication when I'm supposed to take. But this is now robotic surgery. And y'all, I can walk around the house a little bit without the walker. I am so proud of myself. And I had my surgery October the 10th. Y'all, please forgive me. You see, this is the ice machine and it runs through here. And then y'all here, I'm trying to do it the best, y'all. But I'm so proud of myself. I am so proud. I can't wait till I do outpatient surgery, go back to my physical therapist. She's going to be like, Alicia, y'all, this is my 14th surgery. Went through with breast cancer and everything. God is hit. God is good. Woo, y'all, I got to rest for a second. Yeah, my backside is hurting, but I'm trying to take it off. See, y'all? Look, y'all, all this stuff here, y'all, forgive me. Ugh, I got to lay for a second because sometimes the pain will shoot up in your back. But you know what, y'all? I don't have no pain at night. They must be giving you stronger medicine. I sleep good, so good at nighttime, y'all. Y'all see? Y'all, what it looks like? And look, y'all, when you take it off. Ooh, these white tapes be hurting, y'all, but I'm going to try to show y'all. Because they stick so hard to your skin, Lord. It looks like a marker. Boy, they came. Ooh, I'm trying to show y'all. Let me see if I can get off the bed a little bit, y'all, and show y'all a little better. But y'all, it's so hard to take off this thing. It really is. But y'all can see I lift it up. Uh, when you're bending it, it hurts a little, but hey, I'm getting up there. It's not as high up there yet, but at least I feel proud of myself, y'all. I'm trying to take off the thing, but the physical therapist, he put it on so tight. So I want y'all to see what robotic kind of looks like, y'all. Ooh, my God. This tape is on so tight, y'all. I feel like my skin is coming off. I want to show y'all a little bit of it, if I can. You see what it looks like, y'all? This is robotic. Because I don't want to take the rest of the tape off, y'all, because it hurt. But yeah, this is what it looked like. The leg is a little swollen, but it will go down in time. I ice it. But don't it look like, y'all, just somebody took a marker? But this is what robotic surgery looks like, y'all. And you see, you gotta kind of see your leg up and down. I'm just so proud of myself. I am so proud. And then you tighten it. You gotta tighten that muscle calf, y'all, and then release. But y'all can see it up closely, y'all. But yeah, not bleeding and everything, y'all. And it's been like, whoo, October the 10th. I know y'all like, good Lord, Letha is swollen. But that will go down. But I'm proud, y'all. I can lift it up. Y'all can see it closer. Bring it down. Lift it up. But y'all, so y'all can see what robotic surgery looks like. And you do get up and walk the same day. See, I can bring it up. It can't go all the way up yet, but I'm proud. I'm getting there, y'all. Progress. How different it looked in the old fashioned way, y'all, 7 years ago. When they used it like fish hook lines and the lines were sticking out. But they got plastic over it, y'all. And I go for my checkup November the 1st. Y'all don't know how bad this itches. Y'all don't know how bad I want to get in the tub. But you can't get in the tub. I'm allowed to get in the shower, but I'm scared to stand in the shower unless Leah's here with me. Because God forbid I slip and fall and bump myself. But yeah, y'all can see the robotic surgery. And y'all can see the old fashioned way, right knee placement. So y'all, this makes my 14th surgery. I'm so proud that I pushed myself, and I know God is good. When you do things and you want to accomplish it, there's nothing that y'all can't achieve. Y'all, if y'all could go through all these surgeries, spine surgery, y'all, arm surgery, breast cancer 5 times, and God has pulled me through everything. Your blessings are so grateful. I want to thank everybody that was praying for me, family, friends, everything. I thank y'all so much from the bottom of my heart. Yeah, they got me on blood thinners, pain medication. I got to take aspirin for a whole month, y'all. They just want to make sure that you're all right. And some other kind of medications, 4 medications I had to take. But yeah, I can see, yes, a little swollen, but thank God it's not, I can actually sleep at night. No problem. You can sleep sideways. You can slide anywhere. And y'all, remember, you practice with your feet going up, down. That helps circulation. That helps you not have no blood clots. But yeah, y'all. But y'all can see. Here, my friend Leah, she comes every day. She'll come sit with me for an hour or a half an hour, make sure I'm okay. Yeah, I walked around the circle 3 times with the walker. I felt so proud, y'all. And I walked around the back of the parking lot. So I'm proud. And I just had the surgery Tuesday, and this is Saturday. Yes, and I walked. And you know what makes it, y'all, with the robotic surgery? It straightens your leg, and somehow it makes you a little bit more taller. You're not walking slouched over or anything. You're walking real tall and straight now. It's just amazing how far they came. But yeah, I do my exercise faithfully, y'all. You know. When they told me to bend this leg and lift it up, hold it, bring it down. I had to do it 10 times. They want me to do it 30. So 10 in the morning and then release. 10 in the afternoon and 10 at night. Hold it there. Drop it down. And always, y'all, do your ankle pumps. That will help prevent blood clot. You don't want that, y'all. Y'all forgive me of my legs, But I wanted to show y'all, the difference between the old-fashioned way. The old-fashioned way, y'all, I was up for 3 months straight every night screaming. The pain was so unbearable. When I got home, took my medication, slept good. Is that one time, y'all? I think it was early Thursday morning. I was trying to slide out the bed, y'all. Somehow, I saw myself going down on my face, but landed on my butt. I called my doctor right away. They called me back right away. Child, I just sat on the floor. I couldn't get up. Somehow I had to have the strength with the walker to pull myself up with this leg. Yeah, and the doctor said, well, as long as you can stand on your leg and your no blood is gushing out, or your thing isn't torn, you're good. I don't know, girl. I was going face down. And somehow I flipped over and landed on my butt. But now I have the walker, y'all, more closer to me, to the bed. But yeah, y'all can see me. I can lift it all the way up here. But yes, this is what robotic looks like, y'all. Bring it down. Then up. You bring it down. And I think I'm doing good, y'all. To someone that had it 4 or 5 days ago, I'm proud of the progress. Yeah, you just go up and down so y'all get a closer look. That's robotic, y'all. That's how it looks all the way down. And you can see there's no blood or nothing. So I think when he comes Monday for therapy, he's gonna take it off. But yeah, I couldn't take the rest of it off because I mean it hurts when they got this tape attached to your skin. Now it don't want to stick back on there, y'all. But woo, child, thank God, y'all. Just keep using your ice machine. Everybody's different, and sometimes I'll do this in the bed. Just to keep your legs, because you don't want your legs to get stiff. Always keep them underneath your ankle. But yeah, now y'all, with robotic, you can take a shower right away. You can sleep in any position. Sometimes I lay on my side, but then they want you to straighten it and tighten your muscles right here and let it go as hard as it can and go down. And then y'all, I have the other thing right here. I want to show y'all an example. Y'all don't think I'm being vulgar. You got to put the towel directly underneath your knee, y'all. And this is the hard part, y'all. Then you got to like tighten it and lift it up and then bring it down. Because they want that leg to be straight. Press down on it. Tighten it. Ooh, y'all, that be hurting, but it helps your muscles. But yeah, y'all, but again, y'all can see the old-fashioned way where they used to have the fish, look like fish hooking lines, just sticking out all out the place, and they would clip it when you go there. But now it's just different, y'all. So y'all have a blessed weekend, and I'll keep showing y'all the progress of me. I'm determined, y'all, to walk. I am determined to walk with just my cane, and then I'm determined to walk without my cane. Y'all know me. I don't. When I was going through my cancer, I didn't let the chemo, the radiation, I didn't let that let me down. I just kept pursuing. When I had the spine surgery, y'all would have been laughing at me at the surgery, y'all. I was so hungry, y'all. I was up 4 o'clock in the morning. The medical van got me 5. We got there 6. Child, I was so thirsty. You couldn't even suck on an ice chip. They wouldn't even let you have one ice chip. I'm sitting in the waiting room, falling asleep, y'all. Y'all just don't know how sleepy and how thirsty. How bad I wanted a jug. Cause y'all know I carry my jug of water. And I just couldn't. I couldn't have nothing. So then when it got around 10 o'clock, imagine y'all up 4 o'clock in the morning, nothing to eat, nothing. Then a little bit after 10, they finally call you. They always call me by my wrong name, Althea. They wheeled me in the room. I had to take off my clothes. They put it in the bag thing. They labeled my name. They wrote down everything I had in my purse and everything. So God forbid everything missing. They got it on record. They put it in the locker. Then they wanted me to go pee. Then I sat in the hospital room in the back there with the gown on. They checked my heart monitor and the thing they put on your finger, and they started the IV. Child, she had me scared when she was like, "Your blood pressure is real good," but she said your heart rate is slow. She said, "Is it always slow like that?" And I said, "No." So then the anesthesia guy came. Boy, he couldn't wait, boy. He was like, "You ready? I'm going to stick this in your back. I'm going to do this and do that." Child, he was getting me so frustrated. All of a sudden, my heart rate started pumping faster and faster. He said, "Oh, there we go. Her heart rate is going up." So the nurse there, she was nice. She put it in up here through your skin. She found it the first time. Child, after that, they made me take 6 medication. Where I was able to sip a little water. Y'all don't know how bad I craved for that water. Y'all, then he came with that big behind needle, that nerve block. And he had put it through my knee. I said, "Jesus, Father, please don't let me kick this man in his face, Lord." It hurted so bad, but you gotta stay still, y'all. It feel like it goes right through your bone. Then they wheeled me into place, y'all. Now I'm not scared of the surgery, y'all. I'm scared when they be rolling you down. You remember they roll you down the thing and it starts getting colder and colder. They rolling me down there. They open up that big operating thing, and I see them bright lights, y'all. Y'all know I wanted to panic so bad, y'all. Y'all just don't know. I just wanted to jump off the table and be like, "Forget this." So they knew that I had, spine surgery with the metal plate and screws in my neck. So one of the nurses, she's sitting me up, y'all, on the operating table. They'll shoot me with the epidural in the middle of my spine and then twice down there by my butt tail. And then she's pressing on my neck. I'm like, "Ma'am, you're hurting the metal plate in my neck." Y'all don't know how bad I wanted to cry. Y'all, that's all I remember. I woke up, I was in the recovery room. I don't even recall if they laid me down on the table or they sat me up that had the surgery. I can't tell y'all that. All I just remember, I woke up. You go in 2 recovery rooms. You go in the first recovery room. I'm open up my eyes, but still it's a little bit half closed, and I see the nurse next to me. She was so nice. She was rubbing my leg. She said, "You okay, Miss Out there?" And I said, "I'm cold, y'all." All of a sudden, I started shaking real bad. Y'all thought I was doing the Harlem Shake. My teeth was shattering so bad. So she had and got me 2 or 3 blankets, with the heat on it. Then she had got this plastic tube that she put under my blanket by my chin, and it shot out warm air. Y'all don't know how good that felt. Then she said, "Is anybody you want me to call?" And I said, "Yeah, call my friend Leah." And then she was telling Leah how good I'm doing and everything. They're amazing and stuff. So then they wheeled me into the second recovery room, y'all. This is where you're hungry as hell. All I know is I'm sitting up. I can see my knees been done. I see other patients next. I see other patients next to me, y'all. But you know they have like the blind thing, but you can kind of see them across. The nurses came over. She was so nice. She was like, "You ready to eat?" They gave me a big box, y'all. It had a big turkey and cheese sub. Child, that sub was so good. And then they had a package with this soft, gooey oatmeal raisin cookie. It had a bottle of water in there, and they gave me the tiniest swept ginger ale. Y'all, I love my ginger ale. So she gave me that child. I ate everything in that box. You hear me? Either I was so hungry or that stuff was tasting so good. So then the social worker comes over. She's like, "Okay, we're bringing your walker. We're gonna get you up and see you walk." So I'm scared to put my foot down because when you put your foot down, it don't feel like it's on the ground. And I'm like, oh my God, I can't feel my foot. Maybe because the anesthesia was still trying to wear off. So she's walking me around the whole nurse corner and she was like, "I'm proud of you. You're walking pretty good." So then she sits me back in the recovery room and she says, "You know, before you leave, you have to pee. Before you had to move about. Now, y'all, if y'all don't go pee, they ain't gonna let you go." So they let me know, the therapist gonna come to my house the next day. They don't be playing. They have everything in pack. Then she walked me to the bathroom. Y'all, she comes inside the bathroom with me. I guess they want to make sure you don't fall or anything. I'm stooping over because I ain't sitting on nobody's toilet, y'all. And y'all just imagine y'all having knee surgery and you trying to stoop over. And she's like, every time somebody comes in there, they disinfect that place. So I sat on the toilet seat. She helped me wipe myself, wash my hands. We go walk in the other room where there's stairs that I have to climb. She's showing me go up on this knee first. They always want you to, I think, walk on your bad knee first going up the stairs and walk down on your good knee. Forgive me, y'all, if I'm doing it wrong. I'm walking. She's proud. I turn around, walk back down. Then she lets me walk around the whole corner. Then they called the medical van. They said they'll be there in 60 minutes. In the meantime, they had this nurse. I had them all laughing. The nurse was like, "Oh my God, you're so funny." She's like, "Your laugh is so infectious, Miss Matthews." When she was helping me get dressed, I said, "Now, come on, y'all." I said, "They're not perky like they used to be." I said, "You gotta lift these babies up." I had them dying laughing in the hospital. So she helped me get dressed. The medical van, they called me on the phone. They say they're out there. So they wheeled me in the wheelchair with my walker, with the ice machine, with the hospital bag and everything. So the guy, he puts the stuff in the van, y'all. And I'm like, the medical van was high and he had a stoop, but I'm saying, "Oh my God, how I'm gonna get in this van." So the nurse was like, "Remember, Miss Mattel, how we taught you." So I had to turn around backwards, hold my hand up, and slide myself in. And she made sure I was safety belt in. And I called Leah and Sharon said I should be home within 20 minutes. They met me by the medical van, pulled up here. They carried my bags inside here, y'all. And I took off my clothes slowly. Um, I wasn't hungry, I was thirsty. I took my medication right away and I went to sleep. I went to sleep good, y'all. I wasn't, I'm telling you, when I had this knee, every night, y'all. I was imagine hearing that every night for 3 months straight. That's how bad the pain was. You could not sleep. They don't want you taking no medical weed, y'all, while you're on the medication because they said it will mess up. with the blood thinners and all that, because I even got the Rice Krispie treat. They said I can't even eat that, y'all. So it's sitting up there on top of the refrigerator until the doctor says okay, and I go for my checkup on the first. But they do call you, the doctor, the nurses, they check on you, see how you are. But yeah, that's the journey of having robotic surgery. It's not really that bad. Yes, there the first night you don't be in pain, but your knee be so sore. It feels like somebody has a rubber band and they tied it so tight in the middle. It's like your knee can't breathe. It just be so sore, and it feel like that rubber band is getting tighter and tighter, and you're like, oh my god, my knee is sore, my knee is sore. And then after the second day, it gets better every day, y'all. If y'all follow the instructions like the doctor says, it's important you take your medication. You don't want no blood clot, you don't want no blood, god forbid, going to your lungs. You could die like that. Do your exercise and be determined going up and down the stairs outside. And they want you to walk, y'all. It's important that you walk, because you don't want to lay in the bed and you just be constantly stiff. That's their goal. They want you to walk as much as you can. Don't push it and try to walk all the way far, y'all. I started off the little circle, then I started going a little bit more around, and then I cut through the parking lot and back in a circle. To me, that's a good achievement. And that was the second day I did that, y'all. And when I'm in my house here, sometimes I don't even need the walker. I just walk, and I walk carefully. And Leah was like impressed. She said, oh my God, look at you walking without the walker in here. You're doing real good. But yes, y'all, everybody's journey is different. If somebody's getting ready to have knee placement, I'm going to tell y'all, it's really not that bad. Don't let people scare you, but I'm not going to fake and funk and be like, oh, you're going to be doing cartwheels. You're going to be feeling good. It gets better each day. And if you had determination and therapy, you're going to be okay. It takes a whole year, like with this knee, to recover. And y'all know me. Every night, I'm so used to going walking with my jug of water, and I'm used to keeping active. And now I have to slow down, and I keep thinking that's what was bothering me, because I'm like, I'm not used to just sitting here. I want to go back walking fast like I used to. But I was proud. I walked it 3 times in one day. I was proud of that. And then I came in and iced myself. Y'all, keep icing yourself. I mean, my legs was way bigger than this. I'm proud it went down. I mean, constantly ice yourself for 20 minutes. You don't fall asleep with the ice machine on you. With the ice machine, um, you fill it up with a little bit of cold water. You can get you a water bottle, put it in the freezer. When that gets solid rock, put that inside there in the ice machine and just let it flow for 20 minutes, y'all. Do it morning, do it at nighttime before you go to bed. You'll be okay. But yeah, y'all, again, it's important, y'all, you bend that knee. Do them ankle pups. It's important, y'all. From my left knee, different from my right knee placement. I can't believe this was 7 years ago, y'all. But yeah, child, you just stretch it out, y'all. You feel you feel good. Everybody have a blessed day, and if you're getting ready to go through your knee placement, it's gonna be okay. Give it to God. Everything will work out, y'all. Just had that determination that you want to get better. When all the surgeries I was going through with my shoulder surgery, everything, I'm like, I'm going to give it up to you, God. Leave it in His hands. You'll be okay. You can make it. There's nothing that God can't do or won't do for you. And everyone, I want to thank everyone again from the bottom of my heart. Even when I was a pain in the butt, y'all forgive me. And I thank everybody so much. I thank all my family, my friends. I thank you for your prayers, your scolding, all that. But I just wanted y'all to see, and I'm going to show y'all, when I get 4 weeks, I'm going to show you the process because this Tuesday will make it 1 week. But I'm proud of the goal I already achieved. But y'all going to see and go on my journey. And everybody have a beautiful weekend. And don't forget, Mama said, be shy, malicious.